everyone. My name is Dr. Dolores Tarver. I'm a licensed psychologist here in Georgia, and it is time for the TT Time with Dr. Tarver is a wellness-based podcast. It is not intended to be a substitute for a relationship with a licensed mental health provider. Yes, it's May. It's Mental Health Awareness Month, and yes, I know I'm late, but don't worry, I'm straight. We are going to be transitioning into this series focusing on the factors that affect mental wellness. And so, to that point, last week I did not have it to give. And so, you're going to get two episodes this week, one today and one on your regularly scheduled Tuesday. So, again, sometimes you just have to make sure that you're following the recommendations that you're giving other people. It has been an intense season, I think, for a lot of people. You all know May is full of graduations, and you've got Mother's Day, which can be challenging for people, just kind of depending on where they are in that journey with regard to potential grief. It may be women who are, you know, mothers who have experienced loss of children. It may be people who have experienced the loss of their mothers. It might be the loss of maternal figures in your life. It could be aunts or grandmas or that one matronly figure, that maternal figure in your life who really poured into you and supported you, and she may not be around in this physical realm anymore. It may be that you've got a really strained, unhealthy relationship with your mother, and so Mother's Day can be really difficult for that reason. For women who may have experienced a stillbirth or the unfortunate and challenging aspects of miscarriage. And so, like, there's no physical child present to show that you are, in fact, a mom, and that can be really hard. And particularly since people don't necessarily recognize that as you of a grieving mother in that experience because you don't have a physical baby that didn't wasn't able to grow and develop full term for whatever reason. So needless to say, like this time, and I think April was just a little rough. We talked about tax season and the job market and all of the stress associated with work. And so I think people just were really hit hard with a lot of stress in April. And now we're coming into May, and people are either still escalating up that stress or starting to come down a little bit. And so we're definitely excited about people taking care of themselves in whatever ways they need to. So as we delve into this series, that's what we're going to be talking about is how we can take care of our mental wellness in ways that we need to. But first, we have to identify the ways that we may not be taking care of ourselves. And so that is your first episode in this series this month is what are the reasons why we're not addressing our mental health and what are the consequences of that? All right, we do that. Let's get into it. So, I think commonly the reason that we don't want to attend to our mental wellness is we don't know how. I think that often for a lot of us, we didn't have mental wellness necessarily modeled for us, particularly if you're a certain age range. So I would say if you're in your 40s and up, there wasn't a lot of modeling of you taking care of yourself mentally. You probably had more examples of people not actually taking care of themselves, and we saw people utilizing whatever coping mechanisms that they had available to them to be able to get through difficult times. We know that for some people there was financial hardship growing up. We know that for people there you might have struggled academically, and how did your family of origin, how did they deal with you struggling academically? You may have had some undiagnosed or possibly diagnosed health or mental health issues and how that was received in your family. And I think sometimes you were in families, if you had multiple children, like families at large sibling groups, sometimes people just felt like neglected, like they didn't get as much poured into them, and that they had to maybe take care of themselves. You might have been in a position where you had to take care of younger siblings, or you might have been, we called them latchkey kids back when I was growing up, but that a lot of responsibility was placed on you to take care of yourself because you had a parent or parents who were working, and so there wasn't anyone there to greet you and meet you when you came home. And so you learned how to cook early, you learned how to keep the house clean, you learned how to make sure that door was locked and you didn't let anybody in. You learn how to navigate and take care of things on your own and not have to depend on other people. And so that can also lead to just patterns of us not knowing how to take care of ourselves because we weren't given space to do that. Things need to be done, they need to be taken care of. You need to take care of them. And so there wasn't this opportunity for like, oh, hey, like I get to rely on other people, or I get to recognize when I'm overwhelmed and people step in and say, hey, you're overwhelmed. You need to take care of yourself. Nobody might have even been checking on your emotional wellness because no one knew to do that. You may have grown up in families where there wasn't a lot of emotional connection. A lot of people tell me that their family was there and they were present, but they weren't necessarily emotionally engaged. I mean, again, that comes from however they were oriented and how they grew up. And some people just, you weren't, emotions weren't nurtured because they were considered to be detrimental. And so a lot of people talk about that they're logic and fact based and they don't necessarily think about emotions. But I tell people the emotions are still underneath there. You've just not known to identify them and recognize them as such. But they're present, even if you don't necessarily see them as what you may consider emotional, overly emotional people. But that lack of awareness and understanding, and even being able to have emotional intelligence, emotional well being, being able to connect with your emotional self and recognize that that's one of those wellness areas may be something that's elusive to you because it just hasn't been anything that's been modeled. Secondly, I will say that I think for a lot of people that even if they do recognize that they're not attending to their mental wellness, they don't want to take the step to do so because they're concerned about what that might mean. Like people definitely have a fear of being stigmatized and labeled. So one of the reasons why people don't go to counseling is because they don't want to have to get a diagnosis. Now, there may be some job-based reasons why people don't want to get a diagnosis, because there has been a time in the history of our country, particularly in the job force, where you had to turn over any kind of information about use of services, whether it was medical, mental, and those could be prohibitive in terms of a career path for you. Now, I would say that that is a protected class. However, things do change, and I will say it definitely depends on your field. And so, you do want to ask some questions and get some understanding about some things, and figure out how information is communicated and documented, particularly if you're not the reason why you're in therapy. So it may be a function of your employment that you had to go to maintain your employment. Like somebody might have told you you need to get an evaluation so that we can make sure that you have the capacity to be able to work in this space, or it may be a pre-employment screening for something, and so that information is going to go to your whoever it is that requested you get the assessment. So it is important to understand the limits of confidentiality. That is a real thing. Your insurance also, whether you know it or not, has the right to request any of your records, and where that information goes, however they manage stuff in their facility, how it would be used to potentially cause you to have an increase in your premiums or be denied certain things. Pre-existing conditions are a thing, and so sometimes even being able to go and participate in treatment can be prohibitive if you have to switch insurance for any reason. Like some people are in a position now where they're needing to look for other jobs, and so when you need to get different insurance, and then they can get information about pre-existing conditions, then that can make them have your rates go up. That might get you denied. So these are the kind of things some places will not see you depending on what kind of diagnosis that you have. And so there is some reality to that, but I think it's important to understand that that's a consultation that you can have to make sure that you know your rights, and you're able to navigate efficiently and still get the services that you need, with little to no impact on whatever it is next steps for you. uh, I will also say that it can be very overwhelming to dive into the reasons why we're not okay. Because often it doesn't start in just this moment. Like it has been things that's been building. It may have started from our families of origin. It may have started pretty early on in our dating life, our young adulthood. It could be patterns that we have. And one of the things that I will say about us is we do not like changing patterns, even if we recognize the patterns are destructive. the devil we know is better than the devil we don't know. And we don't like to have to let go of things. We bit of, hoarders when it comes to holding on to certain things. It could be a fixed pattern or belief. It could be a person or people. A lot of times people are like, oh, I don't want to let this person go because I won't have anybody else. I don't want to cut off my family, even though all they do is do things that are destructive to me, because then I won't have a family and I'll be out here by myself. I don't want to not be in a relationship because I don't like being alone, right? And so sometimes we feel like even if this thing is detrimental to us, the thought of losing it causes us more distress, and so we don't want to go and attend to our mental wellness, even though we recognize these patterns of behavior are contributing to it, because we know that somebody's going to hold us accountable to making some changes, and we're not necessarily ready to do that, and so we'll avoid it. I think sometimes we don't attend to our mental health because it would mean that we would have to acknowledge that, in fact, there are some things that we need to address. And so we'll make statements like, oh, therapy could be beneficial for people, but it won't be beneficial for me. Or like, what's the point of me going to talk to a stranger? I got friends, they can help me, like if I really need some assistance, or that's, weakness. I can handle stuff on my own. What's some person that doesn't even know me going to tell me more about myself than I already know, which we recognize are defense mechanisms, again, just patterns of avoidance, because I don't want to really have to face some things. Now, I may not want to face it because one of my fixed beliefs is that I'm never wrong and that I shouldn't have to apologize for anything. And other people, if they did what I told them to do, would be better off and we could just move on and wouldn't be any issues, right? And that's a pattern suggesting that you need some therapy in itself, that like you don't ever feel like you're wrong. You feel like you get everything right. Okay, then. So I think those challenges can really interfere with people. When people aren't ready, I will tell you that therapy is not beneficial to people who are not ready to come to therapy. If you don't believe that therapy can help you, if you don't feel like there's anything that you can learn, if you're not ready to address your issues, because again, we like to keep stuff safe. We want to do stuff in secrecy. That's when you're trying to protect things, you keep it hidden. I can't be putting it out in the light and let some therapist come and expose it, and then I and then have to address it, right? Like then it would be something real and valid coming from someone else, and we like to be dismissive of that. So, we'll just talk about the profession and say you all don't know anything anyway. It's a quack science. I can, have a healthy diet, get some exercise, and be fine. And so I think whenever you're in spaces like that where there is just literally active resistance about the benefits of anything, and you're boxing yourself in this corner, whether that's I don't want to go to marriage counseling because I don't want to have to be talking to somebody, I'm put our personal business out there, it doesn't help, it makes us worse, all of it, then you're limited in terms of when we've exhausted our ability to problem solve, which is why we got to a point where we needed couples therapy in the first place. Then what are our other options? And again, that just speaks to the avoidance of having to really deal with things. And so, we're kind of in that pattern again. I will say too that I feel like a lot of times, if you've ever had a bad experience with mental health, then that may be something that's prohibitive. Like, so when I did try to take care of myself, when I did try to put a boundary in place, when I let people know what my needs were, and it still didn't work out, nothing changed, and I'm still in the same place, like I'm not going to keep putting myself out there to have that happen again. And so I think sometimes those negative experiences, or perhaps you had a negative experience with a mental health provider, or maybe your first introduction into mental health was you being forced to talk to someone because insert whatever there. It might have been a grief experience early on when you were a child. And so your family was like, oh, you need to be in therapy. You didn't quite understand therapy, and you were still very much in that place of hurting. It was hard for you to really talk about it, much less connect to this stranger. So it wasn't a positive experience. Or maybe it just wasn't a good fit. Therapy is just like any other relationship. Like, you have to have a good fit with your therapeutic provider, and sometimes that's just not the case. You won't necessarily get the best fit your first time. And so learning how to be able to find who's a good match for you and what you need, and being able to kind of do a consultation with people to understand what are some of the things you're looking for, what's their style and approach, and if they're a good fit for you based on their training and expertise and your need level. And I think a lot of us didn't know that information. And so when we first got into therapy, it might have been because we had an employee assistance program at our work. And so they just matched us with an agency who accepted that EAP. We got those first several sessions covered under that EAP, and it wasn't out of pocket. And then when that ended, it was like, I don't know that that was beneficial or not, but like I'm good. Or it may have been that your insurance provider set you up by giving you a list of names of people that were in your network. And so you just picked the person based on that list, didn't know anything about them and if they would be a good fit and what their style was or what your needs were, and they just weren't. And I think that we also feel I think we feel bad, and I tell people when they come in to see me for their first session, hey, if for any reason, because I am not vain enough to think that I'm going to be the best fit for everybody, if for any reason this doesn't end up being a good fit, please tell me. Don't just drop out of therapy. I'm not going to be offended. I'm not going to take it personal, because if you feel like it's not a good fit, I probably am feeling that too. And so let's talk about it. If it's something that we can address, like maybe it's something like, oh, hey, I didn't know you needed that, or maybe you just weren't oriented to how to come to therapy, because I think a lot of times people are like, oh, I just show up, and they don't prepare for therapy. You got to prepare for therapy. Make your list, think about, especially after we talk about your treatment goals, like, what am I doing toward these treatment goals? What kind of obstacles am I having? Here are my challenges. And so therapy is an active process. And I think sometimes people passively come to therapy expecting that there's going to be some, magic wand, like, oh, hey, boom, do this and all will be wonderful. No, therapy is work and strategies, and you're going to be doing the work. We're just guidance for you. And I think sometimes because of that misunderstanding, it cannot be a good fit. But once we get an understanding, then it's like, oh, okay, well, shoot, I can ask for what I need. Most certainly. Like you are the person who is going to know what you need to some extent. Now, again, techniques and strategies, like that's why we're here, guide you, but it is going to be based on the information that you provide. So if you don't provide information, we cannot do anything with information we don't have. And I think that's the other thing, is sometimes people selectively say what is going on in their therapy. And so you're bringing only part of the story, part of the information, and you'll be like, oh no, everything's good. And you'll be like, so I, didn't really see any purpose in going. And you weren't addressing the stuff that you actually needed to address. One, because it might have been uncomfortable for you to address. Two, maybe you don't want to. Sometimes I think a lot of people feel as if they don't want to let me down as their therapist, or don't want to disappoint whoever they're seeing, or don't want to look bad in front of them. And so they present this image that isn't quite accurate. And so they're not really addressing all these other aspects. And so if you're not bringing anything to us, then we're going to, when you say, hey, I think I'm good, we're going to say, okay, you are, because you haven't brought us anything else. We're not mind readers, so we're not going to necessarily know if you're not being fully honest. Those lies by omission. So I think that can be a challenge, but once that is addressed, then therapy can go really well. But then sometimes it's just not a good fit, and that's okay. And what I'll tell people is I'll do my best to try to better understand what your needs are to get you to a better fit. It might be that I didn't have the expertise to particularly deal with this issue, and sometimes people will not necessarily say all of their challenges up front or put it on paperwork because they might be a little bit embarrassed about it. And as they get into it, I'm like, oh, that's beyond my scope. Like, you actually need this, right? And then it's just let me refer you to somebody who does that, and I can help make that transition for you. I will also say that sometimes people don't feel supported in their decision to come to therapy. And so that might be you are a part of a faith based institution, or in a faith based community where people say therapy is not consistent with your beliefs. And so you're discouraged from going. You could be discouraged from going by your family members. It may be somebody you're in a relationship with. It could be somebody that's in your family of origin. It could be extended family who tells you don't need to be going to therapy, and they're drilling you about therapy because they're concerned about how therapy might impact your relationship with them. So sometimes they're just outright negative about it, to a point where it's causing confusion and chaos and division. And so you just stop because of that, or you don't go, you don't initiate therapy because of how it's negatively viewed. And I will tell people that it's really important for you to decide what you need. And even if other people, some people don't tell folks they're going to therapy for this very reason, because they don't want that extra judgment or that inquisition that sometimes can happen, or that sabotage that sometimes people will try to do to deter people from going to therapy. So those are some of the reasons, not an exhaustive list, but probably the common ones that I hear from people about why they don't end up going to therapy. And then I will say, in terms of, so what is the outcome of us not addressing? Oh, the other thing I will say is time commitment. Time commitment and finances, I would say, are the last two. Sometimes we don't make time for therapy. Now, sometimes you're in a position where you literally are just barely hanging on and you're trying to navigate a lot of things, and you're in a season where things are just really intense. But that season will change and you'll get back to a more manageable place and time where you be able to have time for therapy. And it is important that you're able to go regularly and consistently in order for it to benefit you. You don't want to be having starting off therapy with, every 4 to 6 weeks. You're just starting, so you need to probably go at least every 2 weeks, if not weekly, depending on what your needs are. And so making sure, again, that you have a therapist that has that availability to be able to see you as frequently as you need it. That could be another challenge, but also the finance piece, in that people maybe don't have insurance, or don't have transportation, and so they don't feel like they have options for therapy. There are always options for therapy for you when you don't have insurance. It's just a matter of being able to connect with what they are in your community, and some places will even provide transportation to you, in order for you to be able to access what they call sliding scale, or no cost therapy services. Sometimes it's not always the greatest places, but it's at least a place where you can get some things going. And then when you're able to get in a different situation, you may be able to transfer. So, what happens when we don't get our therapy? A few things. One, all the bad stuff increases, right? So if I don't have good coping skills, I'm going to go to my negative coping skills. So that might be substance abuse, that might be shopping, that might be eating, that may be not eating, that may be restricting, it may be purging, it may be, right, because we're trying to control in these just ways that aren't necessarily healthy, but it's all we know. And we like to do what's comfortable and convenient, and also familiar to us. Also, things again that we can keep safe and do in the privacy of our home: gambling, smoking. Um, these are the things we can hide from other people, and they don't know we're falling apart. It may be that you're seeking unhealthy relationship dynamics in order for you to be able to cope and manage. And a lot of us, that's part of our pattern, right? Is we keep reaching out to people, trying to get that love, support, encouragement, and validation. And it is simply something that's just a temporary situation, but we'll cling on to it and we'll keep utilizing it because, again, we don't have any other options. I think you can also just strain your current relationships with people, because then you're trying to use your friends as your outlet to dump all this stuff that you got going on onto them. All right, so you dumping and sleeping real good, and they struggling, and it feels like there's constantly something going on with you, and you're draining them. And so then you'll notice that people just stop inviting you places or don't want to be around you because of who you are in those spaces. You're angry, you're irritable, or you're depressed, you're disengaged, or you're causing conflict, you're being difficult, you're being combative. You're talking to people that you don't even have a close relationship with about your personal things, or maybe you're overbearing, and you think you're right all the time, and so you're doing all of these things that are just causing people to be uncomfortable. And so, people are going to start avoiding you, or you're going to find that you're going to have a lot more conflict in the relationships you do have. We know that there is always going to be residual in our bodies of emotional and mental things that we didn't deal with. And so those physical health problems are going to go right on up. So more pain, more GI issues, headaches, problems sleeping. It could be weight gain, it could be weight loss, any number of areas in terms of the clenching of your jaw, and grinding your teeth could come up, and then also just exacerbating, like your menstrual cycles we talked about in a couple of months ago, could also be contributing to you just feeling worse and you're not addressing anything. And so then you're constantly on this loop in this cycle where your mental health is getting worse. So you might have some psychological or some medical problems that are exacerbated by the fact that you're not addressing them, or you're trying to use unhealthy coping mechanisms to address them. Um, I will also say that like our problem solving skills need practice, and so when you're not learning skills to be able to problem solve, to be able to hold yourself accountable, to be able to challenge yourself, to grow, to adapt, to be able to have introspection. Like if you don't use it, you lose it, or if you never get it, you don't ever grow it. And so then we end up really having more problems just being able to adjust to and deal with everyday life and transitions, and changes in your life, and be able to adapt and cope in healthy ways, because you literally are not growing any new skills, or fine tuning the ones that you have to be able to better use them to serve you. Usually our self-esteem, our worth, our self-confidence, which is our belief in our abilities, like that also is going to tank when we're not addressing our mental wellness. We are going to be more tired. We are going to have more burnout. We are going to not be able to attend and concentrate and be as productive because we're not addressing it. And I've used this analogy before about the trash can, where if you don't empty it and it's just going to overflow. Now you out here bleeding all over the place. It's showing up at work. You're getting written up at work. It's showing up in your leadership positions, in your community organizations, in your faith-based institutions. And so now you're beginning to see like other areas are also out of balance, and it becomes a domino effect. And it's like, okay, well, nothing is going well. Like I have good relationships with my kids right now. They're asking what's going on with me. My partner is asking what's going on with me. My friends are like, what is the deal? And then I will also say, like, you are going to notice that everything is just harder. And so when you're not attending to your wellness, then it is like you're somebody used the example of a train pulling cars, right? And so you just keep on adding these cars, and you're like, hey, like I'm giving the same amount of power. And I, this used to allow me to be able to move and go and flow without a problem, but now it's like I feel like it's taking me so much more energy to do less. And that's because you're carrying more things. Erica Badu said, bag lady, you're going to hurt your back. Dragging all them bags like that. So the more weight you're carrying, the harder it is for you to get motion and momentum. And you're also going to find that you're able to be less productive, but it's going to take you more time to even be that smaller amount of productive that you used to be. And you're going to find that the challenges are going to feel so much more intense. Like everything feels like it is gotten bigger, and not in a good way, in this bad way of almost to the point being unmanageable because you're so overwhelmed. So, in this May Mental Health Awareness Month, as we're looking at the things that affect mental health and being able to make different choices, let us first start out by saying that you have to attend to your mental wellness. Mental wellness is an important aspect of us. It doesn't have to always be about mental illness, because I think that's what sometimes turns people off. Is they're like, I'm not ill, I'm not crazy, I'm not. And you're not, but what you are maybe is struggling in particular areas to take the best care of yourself mentally, for all of the reasons that I discussed toward the beginning. So, in this season, not just in May, but in every month, 12 months out of the year, make sure that you're attending to your mental wellness. We always talk about you can't pour from an empty cup, but you won't even know to put a cup down if you haven't attended to your mental wellness. All right. You all be well, and I'll see you tomorrow.